You think a simple wash is enough, yet beneath that everyday routine, your skin could be whispering a secret that fuels disease. What if the very barrier that keeps you safe is quietly leaking toxins, inflammation, and the roots of chronic illness? Why do 85% of age-related ailments keep resurfacing even when you count your vegetables and take your pills on time? The answer lies not in your plate, but in the skin that covers every inch of you. Stay with me for the next 19 minutes and I'll reveal a straightforward, science-backed scrub that can turn that staggering statistic on its head. If you've ever felt stuck with stubborn health problems, give this video a like now. You're not alone. I'm Dr. Elena Rivera, a geriatric health specialist with more than 20 years of clinical research behind me. Over the decades, I've watched patients battle the same stubborn conditions, high blood pressure, joint pain, recurring infections, while their lab results show only modest improvement from diet and medication. The missing piece I discovered is a compromised skin barrier that fuels chronic low-grade inflammation. When the outermost layer of your body can't do its job, the immune system stays on high alert, and that constant stress fuels the cascade of disease we see in seniors. In today's talk, we'll explore 4 key parts. First, why the skin matters more than most realize. Second, the 5-step healing scrub you can perform each night. Third, complementary habits that amplify the scrub's benefits. And fourth, how to track real measurable results in your body. Subscribe now so you won't miss the upcoming Walk to 100 series where we take these tips to the next level. Let's first understand why the skin is the hidden gateway to the 85% figure you just saw. Your skin is not just a piece of clothing, it is a living, breathing organ that houses 70% of your immune cells. The outermost layer, called the stratum corneum, is a mosaic of dead cells and lipids that acts like a brick wall, blocking pathogens, allergens, and toxins from slipping into your bloodstream. When that wall is intact, inflammation stays low and the immune system rests. When it becomes rough, dry, or laden with dead cells, it turns into a toxin reservoir. Every day we shed roughly 30,000 skin cells, and they cling to oil, pollutants, and microorganisms. If they pile up, they become a breeding ground for biofilm that releases inflammatory cytokines, those tiny messengers that keep your body in a state of chronic alert. You can feel the difference in a simple test. Run your fingertips over smooth, well-hydrated skin versus rough, flaky skin. The roughness is a sign that the barrier is leaking. Another quick visual check. Press a clear piece of tape on your forearm for a few seconds, then pull it away. The tape will reveal a thin layer of dead cells and debris. That is the buildup you want to clear away each night. Remember, a compromised barrier sends distress signals that trigger systemic immune activation, the root of many age-related diseases. Have you ever noticed persistent itching or redness after a hot shower? That's your body whispering for help. Now that we know the why, let's move to the how. The healing scrub I'm about to share is built on 5 simple steps, each anchored in solid biology and designed for easy daily practice. This isn't a fancy spa treatment, it's a targeted therapeutic routine you can perform in the comfort of your bathroom. Step 1, gentle exfoliation. Use a natural grain-free scrub. Think finely milled oatmeal or finely ground almond shells mixed with warm water. The goal is to loosen the dead cell matrix without damaging the living layers beneath. By breaking that matrix, you allow the skin's natural lipids to realign, restoring the brick wall function. Apply the mixture with circular motions for no more than 1 minute, focusing on elbows, knees, and any areas that feel rough. Step 2, mineral-rich rinse. After exfoliation, rinse with water that has been enriched with a pinch of sea salt and a splash of magnesium-rich Epsom salts. The minerals help draw out lingering toxins and calm any microinflammation triggered by the gentle abrasion. This step also supports the skin's natural pH balance, keeping the protective acid mantle intact. Step 3, antioxidant infusion. While the skin is still damp, pat on a thin layer of a botanical oil such as rosehip seed oil or a blend of jojoba and vitamin E oil. These oils are packed with antioxidants that neutralize free radicals produced during exfoliation and reinforce the lipid barrier. The antioxidants also signal skin cells to repair and regenerate, effectively sealing the wall you just cleared. Step 4, hydration lock. Follow the oil with a light, fragrance-free moisturizer that contains ceramides and hyaluronic acid. Ceramides are the building blocks of the skin's barrier, and hyaluronic acid draws water into the upper layers, keeping the skin supple. This step ensures that the barrier stays sealed throughout the night, preventing the nocturnal leakage that can spike inflammation while you sleep. Step 5, mindful breathing. Finally, as you finish the routine, spend 2 minutes breathing deeply, inhaling through the nose and exhaling through the mouth. This simple practice activates the parasympathetic nervous system, reducing systemic stress hormones that could otherwise undermine the skin's healing process. It's a small addition, but the synergy between physical care and calm mind amplifies the anti-inflammatory effects. Each of these steps is backed by research showing that restoring the skin's barrier can reduce markers of chronic inflammation, improve glucose regulation, and even support a healthier gut microbiome by limiting the entry of unwanted particles. If you're finding this valuable, hit that subscribe button and let's keep exploring together. What do you think about adding a nightly skin ritual to your health toolkit? Share your thoughts in the comments. I'm eager to hear your experiences. Before we move on, remember that the scrub works best when paired with a few complementary habits. Stay hydrated throughout the day, choose loose-fitting clothing to avoid friction, and aim for at least 30 minutes of gentle walking each day to boost circulation to the skin. In the next segment, we'll dive deeper into how to measure the real results, tracking skin hydration, inflammatory markers, and even sleep quality to see the transformation in your own body. Stay tuned because the journey from a leaky barrier to a resilient, disease-resistant self is just beginning. Now, let us turn our attention to the practical side of proof. How will you know that the nightly ritual you have just adopted is truly shifting the tide in your body? The answer lies in 3 simple pillars of measurement: skin hydration, systemic inflammation, and restorative sleep. By observing these signals day after day, you can watch the invisible barrier begin to seal and the cascade of chronic disease start to recede. First, consider the surface of your skin as a living gauge. When the outermost layer is well moisturized, it reflects a healthy lipid matrix that prevents unwanted particles from slipping into the bloodstream. To assess this, I recommend a 2-part approach. The first part is a tactile test you can perform each morning. Lightly press the tip of your finger against the forearm, then release. If the skin springs back quickly, you have good turgor. If it lingers or feels parchment-like, you are still in need of extra barrier support. The second part is a simple, inexpensive device known as a cornometer, which measures the electrical capacitance of the skin and translates it into a hydration score. While the device itself may sound technical, the reading it provides is straightforward. Higher numbers indicate better moisture retention. Lower numbers signal a leaky barrier. Keep a notebook beside your bathroom sink and record the score each night after you have completed the 5-step scrub and the calming breath work. Over a period of 2 weeks, you should notice a gradual upward trend. If the numbers plateau, consider revisiting the steps. Perhaps the exfoliation was too aggressive or the moisturizer lacks sufficient ceramides. Small tweaks can produce noticeable jumps in the reading. Second, let us examine the invisible fire that fuels many age-related ailments, chronic inflammation. While the word may feel abstract, there are concrete ways to monitor its presence. One of the most accessible methods is a blood test that measures C-reactive protein, often abbreviated as CRP. Elevated levels of CRP are a hallmark of systemic inflammation and have been linked to cardiovascular disease, diabetes, and even cognitive decline. Many primary care physicians offer a high sensitivity CRP panel as part of an annual wellness visit. If you are already under medical care, ask your doctor to include this marker in your next routine checkup. Record the value before you begin the skin regimen, then repeat the test after 6 weeks of consistent practice. A modest reduction, even by a few milligrams per liter, is a sign that the barrier repair is decreasing the influx of irritants that would otherwise stir the immune system. Another useful marker is the fasting insulin level, which reflects how well your body is handling glucose. When the skin barrier is compromised, inflammatory cytokines can interfere with insulin signaling, leading to spikes in blood sugar. By monitoring fasting insulin alongside CRP, you obtain a dual view of metabolic health and inflammatory status. Third, we arrive at the restorative sanctuary of sleep. High-quality sleep is the nightly renovation crew that repairs tissues, consolidates memory, and balances hormones. When the skin barrier is leaking, the body must divert energy to immune defense, often at the expense of deep, rejuvenating sleep. To gauge improvement, use a simple sleep diary. Each night, note the time you retire, the estimated time you awaken, and any awakenings during the night. Also, give a brief rating of how rested you feel in the morning on a scale of 1 to 10. Over several weeks, you should observe longer stretches of uninterrupted sleep and higher morning vigor scores. For those who prefer a more data-driven approach, many smartphones now include built-in sleep trackers that estimate sleep stages based on movement and heart rate variability. While not a substitute for clinical polysomnography, these tools are sufficient to spot trends. If you notice that you are consistently achieving 7 to 8 hours of sleep with a majority of deep sleep phases, it is a strong indicator that your barrier repair is supporting overall homeostasis. Now that we have outlined the 3 pillars, let us discuss how to integrate them into a seamless weekly routine. Begin each evening with the 5-step scrub as described earlier, followed by the mindful breathing session. Immediately after, apply the ceramide-rich moisturizer and take a moment to perform the skin turgor test. Record the tactile impression in your journal, and if you own a corneometer, note the numerical reading as well. Then, before you settle into bed, dim the lights, avoid screens for at least 30 minutes, and perhaps sip a cup of warm chamomile tea. This gentle wind down supports the parasympathetic activation you initiated with the breath work, reinforcing the anti-inflammatory cascade. On the mornings after a night of restorative sleep, take a few seconds to assess your skin's feel. If it feels supple and resilient, give yourself a mental pat on the back. If you notice any residual tightness, consider a brief second application of moisturizer before you begin your day. Throughout the day, keep a water bottle within reach and sip regularly. Hydration from the inside works hand in hand with the barrier repair on the outside. When you feel the urge to snack, reach for a handful of raw almonds or a slice of avocado, foods that supply healthy fats essential for rebuilding the lipid matrix of the skin. Pair this with a brief walk of at least 30 minutes, preferably in fresh air. Gentle ambulation stimulates peripheral circulation, delivering oxygen and nutrients to the epidermis and encouraging the removal of metabolic waste. If the weather is inclement, a slow indoor stroll around the house, perhaps while listening to calming music, will still confer benefit. Let us not overlook the role of clothing in maintaining the gains you are achieving. Fabrics that are tight, rough, or synthetically woven can create friction that disrupts the newly formed barrier. Opt for loose-fitting, breathable garments made from natural fibers such as cotton or bamboo. This simple choice reduces microabrasions and allows the skin to breathe, preventing the buildup of moisture that can become a breeding ground for unwanted microbes. You may be wondering how long it will take before you see tangible results. The truth is that each body responds uniquely, but most individuals report noticeable improvements in skin texture and reduced itchiness within a fortnight of diligent practice. Laboratory markers such as CRP often show a measurable decline after 4 to 6 weeks, while sleep quality may begin to rise after the first week of consistent barrier care. Patience is essential. The skin is a living organ that repairs itself slowly, especially as we age. Trust the process, stay consistent, and celebrate each small victory along the way. Now, let us address a common concern. What if you have a pre-existing skin condition such as eczema or psoriasis? The 5-step scrub can still be beneficial, but it requires gentle modification. Reduce the exfoliation frequency to once every other night and choose a milder exfoliant such as finely ground oatmeal instead of a harsher sugar scrub. The moisturizer should be fragrance-free and contain additional soothing ingredients like colloidal oatmeal or aloe vera. Always always perform a patch test on a small area before applying new products to larger surfaces. If you experience any unexpected redness or burning, discontinue use and consult a dermatologist. Remember, the goal is to support the skin's natural healing capacity, not to overwhelm it with aggressive stimuli. For those who are already on medication for chronic conditions, it is wise to discuss any new skin regimen with your healthcare provider. Certain topical agents can interact with systemic drugs, and some individuals may experience heightened sensitivity during periods of medication adjustment. Open communication ensures that your skincare plan aligns safely with your overall treatment strategy. As we move toward the closing segment of today's discussion, let us reflect on the broader picture. The skin is not an isolated organ. It is a dynamic interface between your internal physiology and the external environment. By fortifying this interface, you are essentially building a fortress that filters out toxins, reduces inflammatory triggers, and empowers the immune system to focus on repair rather than constant alarm. This fortress, in turn, supports the cardiovascular system, stabilizes blood sugar, and even nurtures the gut microbiome by limiting the entry of harmful particles that can disrupt microbial balance. The ripple effect of a healthy skin barrier extends far beyond the surface, touching nearly every aspect of well-being. Before we part, I would like to offer a concise checklist that you can keep on your nightstand as a reminder of the essential steps. First, cleanse gently with lukewarm water and a mild sulfate-free cleanser. Second, exfoliate using a soft, natural grain, paying attention to the direction of skin lines. Third, apply the therapeutic oil blend, massaging it in circular motions to stimulate lymphatic flow. Fourth, seal the barrier with a ceramide-rich moisturizer, ensuring even coverage. Fifth, engage in 2 minutes of deep diaphragmatic breathing, inhaling through the nose and exhaling through the mouth, visualizing the skin repairing itself. Sixth, record your skin turgor impression and, if possible, the corneometer reading. Seventh, note any changes in sleep quality and overall energy levels in your journal. Eighth, stay hydrated, move gently, and dress in breathable fabrics. By revisiting this list each night, you create a habit loop that reinforces the desired outcome. If you have found value in this detailed guide, I encourage you to share it with friends or family members who might benefit from a simple yet powerful skincare strategy. Let them know that a few minutes of mindful attention each evening can translate into years of reduced disease risk and enhanced vitality. And of course, if you have any questions, observations, or personal success stories, please type them into the comments below. Your experiences not only help me refine future content, but also inspire the community of viewers who are walking the same path toward healthier aging. Finally, remember to like this video if the information resonated with you, and consider subscribing so you won't miss the upcoming episodes where we will explore deeper topics such as how specific nutrients like omega-3 fatty acids and vitamin D amplify skin barrier repair, and how a structured walking program called the Walk to 100 can synergistically boost circulation and immune resilience. By staying connected, you gain access to a growing library of evidence-based practices designed to keep you vibrant well into your golden years. Thank you for joining me on this journey from a leaky barrier to a resilient, disease-resistant self. Keep caring for your skin, honor the process, and watch as your body gradually shifts toward a state of robust health. Until next time, breathe deeply, move gently, and let your skin be the sturdy gatekeeper of your well-being. Remember, the habit you plant tonight ripples through every sunrise, reinforcing a skin barrier that shields you from the silent storms of chronic inflammation. As you close your eyes, picture each gentle motion of the scrub coaxing dead cells away, allowing fresh, hydrated layers to emerge, layers that whisper to your immune system, saying, "All clear, proceed." In the days that follow, notice the subtle shift, a calmer mind, steadier sleep, and a spark of energy that was once dimmed by hidden toxins. What changes have you already sensed in your skin or overall well-being? Share those observations in the comments. Your story may be the catalyst that inspires another viewer to start this simple ritual. If this guidance resonated, give the video a thumbs up and consider subscribing so you won't miss our upcoming deep dives into how specific nutrients like omega-3 rich fish and vitamin D sunshine can amplify this barrier repair. and how the structured walking program we call Walk to 100 will further boost circulation and immune resilience. Together, we are building a community that values mindful care, evidence-based practices, and the joy of aging with vigor. Keep tending to your skin, honor each breath, and let each step you take be a testament to the resilient, disease-resistant self you are creating. Until we meet again, stay gentle, stay curious, and let your skin stand proudly as the gatekeeper of lasting health.